Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dorothy Shephard, Minister of Health. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, ministre de la Santé. Dr. Russell.
Bonjour à toutes et à tous. Good morning. It's good afternoon. But some places it is the morning, and some places it is the afternoon. Nous commençons à nouveau aujourd'hui en annonçant le décès d'une autre personne du Nouveau-Brunswick des suites de la COVID-19. Une personne âgée de 80 à 89 ans de la zone 4, soit la région d'Edmundston, est décédée des répercussions du virus combiné à celles d'autres facteurs. La personne qui est décédée résidait au manoir Bellevue, un établissement résidentiel pour adultes situé à Edmundston. Il y a eu jusqu'à présent 83 cas confirmés de COVID-19 dans cet établissement, soit 47 résidents et 36 membres du personnel. Again, our briefing today begins with another death of a New Brunswicker from the effects of COVID-19. This individual is aged 80 to 89 in Zone 4, which is the Edmundston region, and died due to the virus combined with other factors. This person was a resident of the Manoir Bellevue, an adult residential facility in Edmundston, where there have been 83 confirmed cases of COVID-19, 47 residents and 36 staff. New Brunswick has now seen 24 deaths related to COVID-19 since the pandemic began. And in contrast to many jurisdictions, this is a small number, but it is a large number in the lives of those people who are connected to those who've passed away, their loved ones, their family members, and their community members. They're well loved and cared for by all New Brunswickers. Every death that we have reported in a person who has had a life, a home, a family, and people who love them, I grieve with the family of the deceased and ask you to join me in offering them our most sincere and heartfelt condolences. La zone 4, dans laquelle ce décès s'est produit, demeure à la phase d'alerte rouge de notre plan de rétablissement, phase à laquelle elle se trouve depuis le 17 janvier. Au cours des prochains jours, nous réévaluerons la situation dans la zone 4 pour déterminer si les collectivités de cette région peuvent rejoindre le reste de la province à la phase d'alerte orange. Les éclosions qui sont survenues au manoir Bellevue et dans d'autres établissements résidentiels de la province sont déchirantes, car les résidents et les membres du personnel sont particulièrement vulnérables au virus et à ses répercussions. Zone 4, where this death occurred, remains at the red alert level in our recovery plan, where this has been the case since January 17th. In the coming days, we will be reassessing the situation in Zone 4 to determine when we can move these communities into the orange alert level with the rest of the province. The outbreaks we have seen at Manoir Bellevue and other adult residential facilities in the province are heartbreaking because both residents and staff are uniquely vulnerable to the virus and its effects. Our public health prompt teams have been working tirelessly to bring these outbreaks under control. It really is incredible how much work these people are doing. I am so proud. Today, I am pleased to report the end of one of our nursing home outbreaks in the province, and that outbreak is the one at Parkland St. John, which was declared on November 21st. It is now officially over. Over the past 2 months, there have been 50 confirmed cases of COVID-19 at this facility, 29 residents and 21 staff. We have done numerous rounds of testing among residents and staff over the past month, and there have been no new confirmed cases in 28 days, which is 2 incubation periods for this virus. All staff and residents at the facility were recently retested to confirm the end of the outbreak. And I would like to acknowledge the very hard work of all the staff at Parkland St. John and all of our partners, including Horizon Health Network, the Regional Medical Officer of Health, the Provincial Rapid Outbreak Management Team, Ambulance New Brunswick, the Extramural Program, which led to the clinical support to residents, and the Department of Social Development. Our continued success in ending these outbreaks hinges on our combined efforts. Everyone needs to continue to wear their mask, maintain physical distancing, practice good hygiene, and support each other as we work our way through this pandemic. Aujourd'hui, Santé publique confirme qu'il y a 3 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a un nouveau cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Il y a 2 nouveaux cas dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin. Il y a présentement 130 cas actifs de COVID-19 dans la province. De ce nombre, 6 personnes sont hospitalisées, dont 2 aux soins intensifs. Je vous demande une fois de plus de garder dans vos pensées et vos prières ces concitoyens du Nouveau-Brunswick ainsi que ceux dont la vie a été touchée par cette pandémie. Today, Public Health has confirmed 3 new cases of COVID-19 in New Brunswick. In Zone 1, which is the Moncton and southeastern New Brunswick area, there is 1 new case. In Zone 4, which is Edmundston, Grand Falls, and St. Quentin, there are 2 new cases. There are now 130 active cases of COVID-19 in the province. 6 people are now in hospital, and 2 of them require intensive care. I ask you to again keep these New Brunswickers and everyone whose lives have been touched by this pandemic in your thoughts and your prayers. And I hope that people were able to enjoy Family Day with those around them. And if you had to visit virtually, I hope you were able to take advantage of that as well. And if you were able to get outside, I hope that was possible for you as well. I was cheered to see many postings on social media over the weekend of families visiting places in or near their home communities and enjoying the day together and finding the beauty and the joy in the place where they live. And you don't have to look far to find it. But I know that not everybody was able to do those kinds of events. And so just keep those people in your thoughts and prayers as well. Je demande à chacun de limiter ses déplacements à sa propre zone de santé pendant le congé de mars. Il sera ainsi possible de restreindre la possibilité que le virus se propage et d'éviter d'autres éclosions semblables à celles qui se sont produites depuis un mois. With March break coming up in a couple of weeks, I do want to see New Brunswickers take the same approach to enjoy this break with their families and staying close to home. Many of the activities we would normally associate with the spring break can't really happen easily this year, but we can still have fun and enjoy the time together. The arrival of new variants of COVID-19 reinforces the urgency of reducing travel and interactions with others, even within our own province. I ask that everyone limits their travel during March break to within their own health zone. This will limit opportunities for the virus to spread and prevent a repeat of the outbreaks that we have experienced over the past month. Our friends in Newfoundland and Labrador are now experiencing the kind of outbreak that we hope to prevent. Driven by the UK variant of the virus, an outbreak that started at a school sports tournament has resulted in more than 200 infections in less than a week and put the entire province of Newfoundland and Labrador in lockdown. We stand with the people of Newfoundland and Labrador in their time of need and trial, as I know they stood with us when cases were surging in our province. And I have been in touch with the Chief Medical Officer of Health there and myself, and the Chief Medical Officers of Health from PEI and Newfoundland also have been in contact with her. The Newfoundland outbreak shows how quickly fortunes can turn during a pandemic and the need for all of us to remain vigilant against the further spread of this virus. The pandemic is changing, even as we strive to get vaccines into as many arms as possible. We need to buy time for our vaccination effort so that we can protect our most vulnerable citizens before the new variants take hold. The good news is that while the virus is changing, our methods for preventing transmission remain effective. The strategies that we have learned over the last year will be effective against the new variants of COVID-19 as they have been against the original version. Wearing a well-made and well-fitted mask remains an effective way to protect yourselves and others. The same is true of maintaining 2 meters of physical distance, washing your hands regularly and thoroughly, and staying home when you feel unwell. Il est toujours essentiel que vous surveillez et surveillez les membres de votre famille pour l'apparition de symptômes de la COVID-19 et subissiez un test de dépistage dès que les symptômes apparaissent. Tout le succès que nous avons connu relativement à ce virus repose sur ces tactiques. Elles continueront à porter fruit si nous travaillons ensemble et nous nous appuyons les uns les autres. It remains vital to monitor yourself and your family for symptoms of COVID-19 and seek testing when symptoms emerge. These tactics have been the foundation of our successes with this virus, and they will continue to serve us well as we work together and support one another. And just to quote Dr. Janice Fitzgerald, who is the Chief Medical Officer of Health for Newfoundland and Labrador, and this was when she was asked about the lessons learned right now in Newfoundland in terms of advice for the rest of the country. You can never let your guard down. It doesn't matter how low your cases are. So on that note, I will turn it over to Minister Shephard. Thank you very much.
Good afternoon, bonjour. I was saddened to learn yesterday that a person has died as a result of underlying complications, including COVID-19. This person was a resident of Manoir Bellevue in Edmundston. Today, we learned that another resident of Manoir Bellevue has died as a result of underlying complications, including COVID-19. On behalf of all New Brunswickers, I want to express sincere condolences to the loved ones of both individuals. Our thoughts and prayers are with you. While these residents did have underlying complications, COVID-19 was the trigger that led to their deaths. And we know behind every one of these numbers is a family. New Brunswickers continue to do the work needed to slow the spread of COVID-19 in our province. We should be proud of what we have achieved by working together. As Dr. Russell said, today there are 3 new active cases of COVID-19 in our province. Yesterday, we had 1 new case. While this is good news that the numbers of new cases are declining, we must not get complacent. Currently, there are 443 people self-isolating in our province. The virus is still with us. We are watching with concern what is happening in Newfoundland and Labrador. That province had done really well in keeping transmission low, but that changed last week. Now they are fighting a new battle against the virus. We were in a similar situation ourselves not that long ago. Outbreaks such as the one in Newfoundland and Labrador, as well as the surge in active cases we experienced in our province over the last few weeks, are a reminder that this virus will take any opportunity to spread. We must do everything we can to not give it that opportunity. Added to that are the new variants of the virus, including the 4 confirmed cases of the UK variant we have seen in our province. That is why we are currently remaining at the orange alert level in all zones of the province except Zone 4, the Edmundston region, which remains at the red alert level. Our goal is to have Zone 4 in the orange alert level as soon as possible. Public Health continues to assess the situation in the Edmundston region to determine when it will be safe to change the alert level there. As I mentioned last week, we are taking a couple of weeks to ensure that we have taken the necessary steps to keep our borders secure before we are able to open things up further inside our province and move to a yellow level of recovery. I do understand this is frustrating, especially for residents who are taking precautions and following the directives of public health. The health and safety of New Brunswickers must come first. I encourage you to remember why we are all doing this. We are doing it to keep all of us healthy and safe, particularly the most vulnerable in our province. I am pleased to hear that the outbreak at the Shannox in St. John has been declared over. It was a long road for the facility, with the outbreak announced on November 21st. Having public health declare the outbreak over is good news and a positive step forward for our province. We are also continuing to roll out the vaccine across New Brunswick. Of the more than 27,000 healthcare workers in the province, including long-term care facility staff, 12,040 have received at least one dose of the vaccine as of Saturday, February 13th. Of the more than 11,000 residents in long-term care facilities, 3,013 have received at least one dose of the vaccine. This week, more than 1,950 healthcare workers are scheduled to receive their second dose of the vaccine at clinics. As well, more than 1,480 people are scheduled to receive their second dose of vaccines at clinics in long-term care homes. We are expecting a shipment of 8,190 doses of Pfizer-BioNTech this week. And we then expect 9,360 doses of Pfizer vaccine weekly through April. Due to the recent reduction in vaccines, we have had to reassess our planned rollout for the province. Further information, including specifics about how the rollout has been adjusted, will be shared later this week. While vaccination is an important tool in fighting this virus, we are still in the early stages of this process. To give us the time needed to achieve widespread vaccination, we must continue to follow the directives of public health and the alert level of the area where we live. While the pandemic has presented us with challenges since it began, we are facing a particularly difficult time at the moment. It is understandable if you feel stuck in winter, in an unchanging alert level, in a pandemic that only seems to be getting worse. The light at the end of the tunnel may feel farther away than ever. But please know that we are making progress. Public health is constantly reassessing the zones to determine when a change in levels will be possible, and we are receiving more vaccine. I encourage you to focus on those positives, to find ways to stay connected to your loved ones, and to reach out for support if you need it. There are brighter days ahead. Thank you. Merci.
Thank you, Minister Shephard, Dr. Russell. Merci beaucoup, ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Laura Brown, CTV.
Hi there. I'm wondering if either the Department of Health or Public Health has reached out to any of the team members in Nova Scotia regarding rapid testing and looking for advice on rapid testing, because it's been used there for the past several months and it seems to be successful. So I'm wondering if you looked to that province for advice on rapid testing.
I do know that public health is in constant contact with their colleagues across the country, and they discuss many of the strategies that have been available. I think I've mentioned several times now that the strategy for our testing protocols, I believe, are sound. We have been using the gold star test, which gives us back a return in 24 hours. We have not been in any position, except for perhaps up in the Campbellton area when we did do mass testing for a few days. We've not been in a position at all where we haven't been able to get people in for testing same day and get those results back overnight. So rapid testing, as we've mentioned before, myself and Dr. Russell, is not diagnostic. It is a screening tool. And so we plan on using it in the future. and we have been using it in the past at our ERs when we have a suspected outbreak in long-term care facilities. So our strategy is, quite frankly, in my opinion, is quite sound. And I think that we're always having those conversations with colleagues in other provinces. I think that's really all I have to say.
Dr. Russell?
Hi, Laura. I just want to support with what Minister Shephard is saying. Yes, we do have conversations with all our colleagues across the country very regularly around testing and all the different modalities that we have to make sure that we are being as efficient and as effective as we possibly can be. There are many things to take into account when we look at our testing strategy, including what we know it has been working with respect to the PCR test that Minister Shephard was referring to being the gold standard. So again, we have many different modalities at our disposal right now, and so we have the luxury of utilizing them in different venues and different situations, which we are. And this will continue to evolve over time. It is an ever-changing landscape, and with the variants at play right now and really trying to limit people's movements, there will be more and more demand for making sure that we are utilizing the best testing at the right time for the right reason, as has been the case for the entire pandemic. So using the right test at the right time for the right reason. Our positivity rates have been good. We always see a little bit of a dip over holidays in terms of making sure that we keep our numbers high enough, but capacity, as Minister Shephard referred to, has never been a real issue, and when we've needed to ramp up based on demand, we've always been able to do that. So again, we'll continue to assess, we'll continue to evolve as the situation evolves.
Ms. Brown, do you have a quick follow-up?
Yeah, I'm wondering, the City of St. John has issued 2 or 3 reminders this month for residents to wear masks in outdoor public spaces. I'm wondering if you've heard of any confusion or compliance issues when it comes to when and where to wear masks outside.
That hasn't overflown to the Department of Health, and I don't believe Public Health, but you know, we always recommend wearing a mask when you're going to congregate outside. We still want you to keep 6 feet of distance, but the policy has been that if you are not in the midst of other people, if you're not having a conversation outside, you can be free to not wear your mask, and wear your mask when you know you're going to be having an encounter with people, and we encourage you to always stay 6 feet apart.
Thank you, Minister. Thank you, Ms. Brown. Harry Forrestal, CBC.
Thank you, Bruce. Dr. Russell, have you altered the initial strategy of holding 1 dose of vaccine back for every dose you administer? And how many doses are in storage now?
Well, our testing strategy has been evolving based on delays in dosages that we were supposed to receive. So that is something that continues to evolve. But as of right now, as of Saturday, February 13th, that is, we have received 26,825 doses, and we've administered 21,182 doses. So we have 7,505 people that have been fully vaccinated, and right now we have 5,643 doses available for planned clinics and second doses for people already vaccinated. So that's really the latest information. We don't have any shipment of Moderna expected this week, but a shipment of Pfizer-BioNTech. We have 8,190 doses coming this week. But that is under the new 6-dose labeling, which requires a different type of syringe to be able to get all 6 doses from that shipment. And we expect that 9,360 doses of Pfizer will be arriving weekly through April. And at this point in time, this coming week, we have more than 1,950 healthcare workers that are scheduled to receive their second dose at clinics this week, and more than 1,480 people are scheduled to receive their second dose at clinics at long-term care homes.
Mr. Forrestal, do you have a follow-up?
Yes, I do. The two most successful jurisdictions for the administration of vaccine are Israel and the United Kingdom. What lessons have you learned from that experience that you're able to employ here in New Brunswick?
Well, the information right now is hopeful with respect to, if you have large volumes of doses and you get them into people's arms, they do what they say they're supposed to do, depending on, taking out the variants because certain vaccines aren't as effective with certain variants. But overall, the whole point of the vaccination program is to decrease hospitalizations and deaths. So the most severe situations and symptoms and outcomes of COVID-19, and that is what they are seeing in those two jurisdictions.
Thank you, Mr. Forrestal.
Thank you.
Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is either for Dr. Russell or Minister Shephard. Scientists are finding new variants of COVID-19 emerging in the United States. What do you know about these new variants? Is there an alarming number of them? And are we testing for them at the national lab, or can we only detect the variants that we are currently testing for?
So the information on variants, Vicky, changes week to week, day to day, and it's really something that's we're staying on top of in terms of what new information is coming out there. As of right now, we are sending our samples to the National Microbiology Lab for that sequencing. My understanding is we will eventually have capacity to do that. But I think what's alarming, no matter where you are in the world, is that there are more variants emerging all the time. So as of right now, we know about the UK variant. We know how it behaves. We know about the African variant. We know how that behaves. But there are new ones that we know about the Brazil variant. We know how that behaves. And so it's really a matter of, again, using all the same measures and protocols for public health that we have since the pandemic began, continue to implement those protocols, and hopefully be able to protect our most vulnerable populations sooner rather than later with respect to our vaccination rollout. But that's where we are right now.
Do you have a follow-up, Ms. Hogarth?
I do. The federal government is requiring people returning to Canada from the U.S. at land borders to get tested upon entry to the country starting February 22nd. Do we know yet how that will work exactly? Will they be tested at the border, at a nearby testing site, and will it be a rapid test?
Still more details.
Yeah, this is still in early developments, and we're really dependent on the federal government for this information, and that has not yet been totally rationalized. So as we get that information, we'll be happy to share that. I think that we're happy to see testing prior to boarding, but I'm not sure all of the details around it.
Thank you. Isabelle Arsenault, Radio-Canada.
Oui, bonjour. Ma question est pour la Dr. Russell. J'aimerais savoir pourquoi le Nouveau-Brunswick a pas reçu toutes les doses du vaccin tel que prévu, donc aurait seulement reçu près de 59% des doses, et pourquoi ces doses-là, justement, sont envoyées dans le nord du Canada. Donc, peut-être revenir un peu là-dessus, s'il vous plaît.
Alors, on travaille très prochement avec Santé Canada au niveau des vaccins et la livraison des doses. On sait qu'au nord, il n'y avait pas la même capacité au niveau des réfrigérateurs, le congélateur qui pourrait garder les vaccins à la dose très, très, très bas. Alors, c'est ça l'information qu'on a été donnée. Et c'est quelque chose qu'on va gérer fur et à mesure qu'on a d'autres nouvelles. Mais c'est ça, on a notre plan et on va continuer à dérouler le plan comme tel.
C'est docteur. Tu as suivi, Isabelle?
Oui, Madame Russell, j'aimerais savoir justement si le pourcentage qui a été envoyé ailleurs, quand est-ce que la province compte recevoir justement ces doses qui auraient dû être envoyées au Nouveau-Brunswick?
Je ne sais pas exactement le nom, mais je peux essayer de le trouver. Mais je crois à ce moment-ci, l'information que j'ai, c'est qu'on va être capable quand même de dérouler le programme d'immunisation pour les plus vulnérables par la fin de le mois de mars. Et ça, c'était quelque chose qui était déjà prévenu. Alors, au fur et à mesure qu'on a d'autres informations, on peut réagir.
C'est Sébastien Lachance, l'Acadie Nouvelle. Sébastien. Sébastien. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour le ministre Shephard. Vous avez mentionné la semaine dernière, je pense que vous étiez en train d'évaluer les règlements de la phase jaune pour voir s'il y avait des changements qui étaient nécessaires avant que les zones passent à la phase jaune. J'aimerais savoir quels règlements vous examinez exactement. Par exemple, est-ce qu'il pourrait y avoir des changements aux bulles familiales ou aux entreprises qui peuvent rester ouvertes pendant la phase jaune?
So we know from prior experience, let me just go back to December, before we went to the yellow alert level in all jurisdictions of the province, we had 44 active cases. And in January, we spiked to a record 567 cases, new cases. So we know from that experience that maybe we need to make some changes. Well, we can't do that in isolation as a government. We really rely on Dr. Russell. We rely on the COVID-19 task force. We rely on the COVID Cabinet Committee discerning those recommendations and then forwarding recommendations to Cabinet. So do I predict changes? There may be, but that will depend on public health and the task force to discern for us. It can't be made in isolation, but we do know that there are risks with going to yellow, and we know by looking at Newfoundland and Labrador that those risks are very, very real with the variant of it mushrooming very quickly, and we saw our own experience in January. So all of those things are being considered now for a proposal to come forward very, very soon in the coming days.
Thank you, Minister. Monsieur Boudreau, as-tu un suivi aujourd'hui?
Ben, je vais peut-être poser une question similaire à la Dr. Russell. J'aimerais savoir un peu quelles règles sont peut-être trop souples en ce moment dans la phase jaune qui pourraient des changements. Qu'est-ce que les gens ont trop de contacts les uns les autres? Ça causerait des risques par rapport aux nouveaux variants, des choses comme ça. Je voudrais entendre là-dessus un peu Dr. Russell.
C'est difficile à dire à ce moment-ci parce qu'on sait que les éclosions qu'on a eues dans la phase jaune et aussi avec le variant, les éclosions à Terre-Neuve et Labrador à ce moment-ci, ça nous inquiète et on veut être en toute sécurité et on veut être prudent. Alors, j'ai pas des détails sur les discussions à ce moment-ci, sauf qu'on aimerait voir la zone 4 aller à la phase orange et on veut avoir une période de stabilisation et aussi pour voir comment la situation va dérouler avec les variants.
Merci beaucoup, M. Boudreau. Merci, Dr. Adam Harris, Brunswick News.
Thanks, Bruce. Minister Shephard, the federal government has released the new vaccine delivery schedule that you alluded to today. And by my math, New Brunswick should now receive enough doses to vaccinate all healthcare workers and all long-term care residents by the end of March. I just wanted you to confirm that and just talk about the ability to now do that if things stay on schedule.
So thank you for that question. I do believe we're going to receive the vaccines that would certainly accomplish that task. However, the date may be a little bit off because I'm pretty sure that one of those last shipments is going to be the week of March 29th. And so we've been very prudent with managing our clinics and our vaccine rollout and making sure that the vaccines are actually on their way to us before we make those commitments. So while your numbers are probably lining up, we will have more to say about it later this week, but also it is dependent on the vaccines arriving in the province in a timely fashion. And so we could be, a few more days out into early April before we're able to complete that first priority Q1 list.
Thank you, Minister. Mr. Harris, do you have a follow-up today?
Yes, please. So the province has been using the Moderna vaccine in long-term care homes. I believe that's because it's more easily transported. But the new larger numbers of vaccines are predominantly Pfizer. Does that complicate the long-term care residents being able to get their vaccines by the end of the March? And is that what you're talking about when you need a new priority list?
It sure does, but that's the issue for the task force to work out, and they've been pretty diligent on this. So we're going to be expecting their recommendations and how we're going to proceed with this. And as I've said, this coming week we are going to be giving you the details of the vaccine rollout. So they should answer your questions even in more detail.
Thank you, Mr. Harris. Yvon Duguay, CKRO. Plus fort, Yvon, on ne peut pas t'attendre. Plus fort. Yvon?
Là, est-ce que c'est mieux?
Allez plus proche à ton micro, chum.
Là, est-ce que c'est mieux?
Oui, continue.
OK. Merci, Bruce. Ma question va pour la Dr. Russell. Je voudrais savoir pour les raisons pour lesquelles, pendant les célébrations eucharistiques comme la messe, on a droit à 50 personnes maximum, alors que pour des autres célébrations comme des funérailles ou des mariages, c'est réduit à 25. Est-ce qu'il y a une raison particulière pour cela?
Vous demandez les nombres pour les messes et ça dans la phase orange ou jaune?
Quoi le changement entre un funérail et un mariage?
Oui, pour une messe ordinaire, c'est 50 personnes maximum, alors que pour des funérailles ou des mariages, c'est la limite est 25. Je me demandais s'il y avait une raison particulière pour lesquelles que ces chiffres étaient changés.
L'idée, c'est de vraiment s'assurer que la distanciation physique est suivie. Il faudra que je revienne avec d'autres détails sur ce point.
As-tu une suivi, Yvon?
Non, c'est parfait. Merci beaucoup à tous.
Merci, Yvon. Erica Butler, CHMA.
Hi there, thank you. I have noticed that our testing numbers have dropped over the past couple of weeks from averaging about 2,000 a day 2 weeks ago to averaging just about 1,000 a day recently. I'm wondering if that concerns either of you, and if it does, then what might you be doing about that?
So we have always consulted our epidemiology team around what would be the baseline number that we wouldn't want to go below, and it's around 3,000 a week. So we're not below 3,000 a week, and again, we look at our positivity rates, and again, usually there's a lag time between when you see cases and then when you would see hospitalizations. So I think if all of a sudden we saw hospitalizations in folks, then we would know that we were missing a larger number of cases in the population. But at this point in time, again, all the indicators that we have are that we are doing okay. Can we do better? It's always important that if people have symptoms, no matter how minor they are, that they get tested. We have capacity. It's easy to call 811 and get the online assessment form referral. So there aren't many barriers that way. So it's really just a matter of making sure that people are aware that they should get tested and make sure that the capacity and opportunity is there.
Do you have a follow-up, Ms. Butler?
Yes, I was just wondering, is there any progress on establishing an arrangement with Nova Scotia to allow shared testing results for people in cross-border communities, such as like the Tantramar area?
Well, we are getting a lot of questions around testing, so we do have actually a common Q&A, questions and answers, commonly asked questions post-testing. So that is on our website. And I don't have any information specifically around that sharing, but I do know that that again, the testing is available on both sides of the borders to accomplish what they need to, whether they're commuters, whether they're going for medical appointments, etc.
Thank you. Marie Sutherland, CBC.
Good afternoon. Question for Dr. Russell. Premier Higgs has said that the province is looking into rapid testing for rotational workers so they don't have to spend their entire 2 weeks in isolation away from their family. I'm wondering why New Brunswick isn't using Fredericton-based Lumen Ultra's qPCR diagnostic test, which provides accurate results in 2 hours, doesn't require a backup test, and will it be incorporating this test going forward?
So Dr. Russell can add to this if she thinks I don't cover it, but it's very common to test a traveler on day 5, day 7, sometimes even day 10, and not get a positive result, but get a positive result later. So we know from our experiments, shall I call it an experiment, we know, but from our policy with regards to international students and temporary foreign workers, that when we had them isolate for 14 days, not one of them transmitted. And so this is the basis for the security that we are asking for with regards to all travelers isolating for 14 days.
Yeah, Minister Shephard covered it exactly. So the risks, really, when you self-isolate for 14 days, regardless of testing, that is the safest approach. And obviously, considering the variants and what Newfoundland is dealing with right now, and again, trying to protect our vulnerable populations while the vaccination program is rolled out, we have a lot of factors right now to consider, and it is challenging. And that's our way ahead right now, for the time being, because again, it's an evolving situation and things can definitely change.
Thank you to you both. Ms. Sutherland, do you have a follow-up?
I do. I know Isabel somewhat addressed this in French, but I'll ask it in English. Health Minister Shephard, the updated federal government website for the vaccine delivery schedule shows, as you know, more than 64,000 Pfizer-BioNTech doses coming to New Brunswick, like between now and April. I've been wondering if you've been told how many of these doses are being diverted to Northern Canada, and have you been given any indication of how long, meaning how many weeks that diversion is expected to be necessary?
So no, I'm going to say that I haven't been told about, exactly what's been diverted. We can get you those numbers to you, but I just want to say that again, because of the new updates and numbers, and if they stay on track, we will be able to get all of our Q1 vaccinations done according to what we've proposed. And we haven't been given a full response yet from the federal government, so we're waiting on those numbers to be sure. Thank you.
Thank you. Savannah, Telegraph Journal.
Hi there. I think my question could go to either one of you. I'm wondering if there's any talk of delaying or canceling March break at this point, given the spike we saw over the holiday break, or rather after the holiday break, and the issue you raised about buying more time to get vaccines in arms. Is that something that's on the table?
So if you're talking about the education system, I'm not aware that there's consideration of canceling March break. I do think that we have appropriate levels of of our alert levels right now, and we've tried to be very upfront with our population, saying that last week that public health needed another 2 to 3 weeks to continue the assessment. We want to get zone 4 into the orange, and then we will proceed cautiously understanding that the reason for this is that we are learning lessons from Christmas, New Year's, from the Newfoundland incident now. So we just have to continue to keep reassessing, and we'll be bringing you updates as quickly as we can.
Thank you. Ms. Odd, do you have a follow-up?
I do. Thank you, Bruce. This one is for Dr. Russell. Speaking of learnings, I guess I'm wondering if public health is looking at kind of a year since the pandemic, why maybe some long-term care homes see a spread that's a bit greater than in others, and have there been any lessons over that time about what works best in these situations? And I guess given that, has there been any effort to maybe update some protocols given the variant has arrived?
Well, we have very regular conversations at many levels around nursing homes, long-term care facilities, adult residential facilities with the Pandemic Task Force, as well as all the partners involved in the prompt teams, Ambulance New Brunswick, Extramural, our RHA partners, et cetera. So it definitely is clear that that certain things work better than others, and so that's why with each and every outbreak, we do actually take the lessons learned from the past outbreak and apply it to the very next outbreak as quickly as possible. And I think we've proven that it works quite well. One of the problems is if there are concurrent outbreaks and too many of them at the same time in several facilities, it is challenging. It stretches resources quite thinly. So I think what we've learned is that based on the COVID-19 virus that we've been dealing with, that we can be very successful. But we know with the variants that this success will be harder to come by and we'll have more challenges, and that's why it is so necessary to be as cautious and prudent as we can possibly be right now while we wait for our vaccination rollout to happen and protect those vulnerable populations in those settings.
Thank you. Aidan Cox, CBC.
Hi, thanks, Bruce. Will the province consider exceptions to the no visitor rule at hospitals for patients who are in hospital waiting for a space at a nursing home? We heard from a family whose loved one has Alzheimer's and has been in hospital for 8 months, and I guess the wait is difficult for them.
This is a difficult situation for many, many families, and of course, as you can imagine, the RHAs and nursing homes, special care homes alike, are dealing with the risks associated with opening up visitation. And so I know that certainly my department, my staff, public health, we have all received many pleas to allow visitation. And we in no way want to bear this hardship on families. But the fact is that the risk is extremely high to open up visitation. We must protect our most vulnerable. And so I know that these will be conversations that will be ongoing. They will be assessed in an ongoing basis as well. And if changes can be made, I think we'd all be the first to jump at it. But it is about managing the risk to our most vulnerable.
Mr. Cox, do you have a follow-up today?
Yes. We have heard from some families who said residents in private long-term care homes are not getting vaccines as part of round 1 of the vaccination program. Is there any distinction between which care homes, for example, private for-profit versus private not-for-profit, get the vaccine first? And if there is, why?
No, I can't say there is. It's our goal to have all long-term care residents vaccinated by the end of March. And based on the numbers we've received recently from the federal government, and if they stay on track, we should be able to come very close to that date.
Sorry, I didn't hear that last part.
If the supply from the federal government stays as we've been indicated recently, then we should be able to manage getting all of our residents vaccinated close to the end of March. But it, as I stated earlier, may go a few days into April because of the timing of the shipments.
Okay.
Thank you.
Thanks.
Sébastien Lechance.
Oui, bonjour. Ma question est pour la docteure Russell. On a eu récemment le calendrier et le nombre de doses de vaccins qui sont envoyés au Brunswick. Au niveau de la distribution dans la province de ces vaccins-là, comment allez-vous procéder est-ce que ça va se faire au prorata de la population ou en fonction des zones de contagion, c'est-à-dire qu'il pourrait y avoir beaucoup plus de vaccins envoyés à Edmundston qu'à Moncton, même s'il y a beaucoup moins de population là-bas?
So I'm going to take that question because the vaccine rollout is by priority group at this time, and priority groups are going to be established, and so as the vaccine comes our way, we will of course be targeting long-term care facilities and looking at the supply that we get from the federal government. We will be targeting that group certainly in a very aggressive manner.
As-tu un suivi, Sébastien?
Oui, j'aurais un suivi pour Mme Russell. Au niveau de la vaccination, il y a plusieurs stades qui ont été prévus selon le degré de dangerosité. Au niveau des travailleurs de santé de première ligne et au niveau des personnes âgées dans les foyers de soins, est-ce que ces groupes-là ont été vaccinés en grand nombre jusqu'à maintenant? Où est-ce qu'on en est rendu dans le processus de vaccination à ces groupes, à ces gens-là qui sont plus à risque?
Alors, à ce moment-ci, on a déjà reçu 26 825 doses de vaccins. On a administré 21 182 doses. Et dans la population, il y a 7 505 gens qui ont eu les 2 doses. Et à ce moment-ci, on a 5 643 doses qui sont planifiées pour des cliniques, pour des gens qui ont déjà été vaccinés avec leur première dose. Cette semaine, on a pas de doses de Moderna cette semaine qui vont arriver, mais on a des doses de Pfizer, 8 190. Et on va recevoir environ 9 360 doses chaque semaine d'ici à la fin d'avril. Et pour les groupes de priorité, au commencement, parce qu'il n'y a vraiment pas beaucoup de vaccins, de doses qu'on a déjà reçues, notre but, c'est vraiment de les avoir toutes vaccinées à la fin de la mois de mars. Ça, c'est notre but, mais ça va dépendre sur les vaccins que les vaccins vont arriver quand ils sont supposés. Mais puis la groupe priorité pour la première tranche, c'était 61 000 personnes qui incluent les résidents de résidence à long terme, des Autochtones et aussi des Néo-Brunswickois qui sont plus âgés que 85, mais ils ne demeurent pas dans les foyers de soins. Et aussi, il y a 25 000 travailleurs de santé et aussi des travailleurs dans les résidences à long terme. Alors ça, c'est notre but et on continue on espère qu'on aimerait avoir tous les gens vaccinés à la fin de la mois de mars dans cette groupe de priorité. Mais à ce moment-ci, on a 11 000 résidents de résidences à long terme qui ont... je m'excuse. En total, il y a 11 000 résidents qui demeurent dans des résidents à long terme et 3 013 ont déjà reçu au moins un des doses de vaccin à partir de samedi, jusqu'à samedi le 13 février. Et les 27 000 travailleurs de santé, qui incluent aussi des travailleurs de santé dans les résidences à long terme, il y a 12 040 qui ont reçu au moins une dose du vaccin jusqu'à le samedi le 13 février.
Merci, M. Lachance. Voilà, ça termine notre conférence de presse. That concludes today's update. Thank you.